our speaker, Ms. Sumki Begum. Ms. Sumki Begum, National Program Coordinator, Outreach. Ms. Sumki Begum did her Masters in Social Work, 3 years experience in the field of cancer care specialization in family and child welfare. She has conducted more than 200 webinars on cancer, 40 plus physical awareness in community and colleges. She has received 2 awards, awards of excellence in the field of cancer care, received award for new innovation in the field of cancer care. Also worked as a welfare officer in University of Science and Technology, Meghalaya. Worked as a field investigator in National Health Resource Repository. We are fortunate enough to get her valuable time today. She will throw light and will discuss her long cherished experience with your people, with our faculties, with our students. Once more, I would like to welcome Ms. Sumki Begum and would like to request her to kindly take on the stage. Thank you very much.
Thank you, Principal Sir. Now I request the speaker to start the webinar. I request all the students and faculties to mute their microphone and put the video up. Okay?
Hello, am I audible?
Yes, you are.
So good afternoon, everyone. My name is Shani Chandra, and I welcome you all to this webinar on cancer prevention and healthy lifestyle. So Sanjeevani Life Beyond Cancer is a non-profit organization working with underprivileged cancer patients. And to know more about our organization, I would like to invite our program coordinator, Sanjeevani Life Beyond Cancer, to give us a brief introduction to the organization and also take us to a presentation on cancer prevention and healthy lifestyle. Over to you, ma'am.
Thank you so much, everyone, for participating in this webinar on cancer prevention and healthy lifestyle. So before moving forward with the program, I just want to give a brief introduction about our organization. So as already mentioned by Sayani, who is our program intern, that Sanjeevani Life Beyond Cancer is a non-profit organization, and we are working with underprivileged cancer patients pan-India. So we are right now working in 16 different hospitals in 16 different cities across India. And our organization was founded by a senior bureaucrat, Ruby Aluwalia. Apart from being a government employee, she is also an author. She's a painter. She's a TEDx speaker. She's a life coach. And most importantly, she's a cancer victor and the founder of the non-profit organization, Sanjeevani Life Beyond Cancer, a pioneer in comprehensive cancer care. So when ma'am was diagnosed with cancer, as she did not had much of financial strains, but then she realized that a cancer, the disease cancer, is not only a disease of mind, not only a disease of physical being, but it has more to deal with a mental construct as well. So based on that, she have started this organization for the underprivileged cancer patients, because when a person is diagnosed with cancer, they face various traumas. They have psychological issues, they don't know what to eat, how to exercise, and as a result, if they go to some like hospitals, or let's say some therapist and all, they have to they will be charged a lot. And that is the reason ma'am started this organization, because when you go for counseling to a normal psychiatrist or anyway, because as this is their profession, they will obviously charge that much. But then keeping in mind that the underprivileged cancer patients cannot pay that much of amount, and that is the reason we have started the organization, it was started in the year 2012 by Ruby ma'am. And I just want to go on a brief about our flagship programs. We have 6 main flagship programs, but as COVID is going on, so right now we are only focusing on 4, because online only 4 flagship programs are possible. So I'm sharing the screen. Okay. So the first flagship program is Cancer Yogi. So we as an organization, we not only work with cancer patients, but we work on 3 aspects. First is how to prevent cancer, and life during cancer, and life after cancer, that is beyond cancer. So we work on all 3 aspects. And the first program that we do is Cancer Yogi. Cancer Yogi is counseling and handholding initiative where we provide counseling to the cancer patient, because no matter how educated a person is, but when someone is diagnosed with cancer, if their family is diagnosed with cancer, they are totally broken down, they are devastated, they don't know what to do immediately. So as soon as the time when they reach hospital, they realize that there are so many patients, there are rumors that cancer patients do not survive, like they have to struggle with so many things around them. At that point of time, we have our Sanjeevani angels, who are basically counselors who work in that sector. And we used to provide help to the cancer patient, starting from how to do registration, how to fill up their forms, how to get free financial assistance, what the doctor have asked them to do, what are the side effects of the treatment, where they will get free medicine, free lodging, free fooding. We used to provide information about everything. And also we used to give counseling based on their nutrition, their thought process, their breathing pattern. We used to also discuss about those things. The next program that we run is Satori. It is a wellness initiative, because whenever a person is recovered from cancer, they are not in a state of mind that okay, we are recovered, so we are, or everything is done. They are in a state of mind that what if it again happens to me, what if it happens to my child or my husband or my wife or my family members. So as a result, those negative thoughts releases lots of negative hormones, and as a result they might again get cancer, that is reoccurrence. And to like eradicate this thought from their mind, we used to run wellness centers. So we have centers in right now we have 4 centers across India, Maharashtra, then also in Rajasthan. So we run the wellness center. Patient used to come there and they used to take different type of therapies such as nutrition, EFT, yoga, sound therapy, laughter therapy, dance therapy, and there are lots of therapies that we provide. But as now we cannot go or patient cannot come to us, then we have decided to do it online on an online platform, that is on Zoom, where patients used to join us, different doctors used to come, and also like different therapists used to come, basically based in Mumbai or Rajasthan and all. And then they used to come, and all the best therapists used to provide therapies to the cancer patient based on their needs. They can ask questions, they can, because due to small problems they cannot run to hospital, so they can ask us directly, they can give us the prescription, we can like interact with the doctor, and then we can help them out with their small problems right now. So that is what we are doing, and this program run for like 1.5 hour. It starts from around 11:15 to every day 1 p.m. So if any one of you are also interested, then you can join this program. And we also provide internship in this like program. So if any one of you are willing to do internship or want to know this kind of therapies, then you can join us. Feel free to contact at our helpline number, that is 8691 000 800, 8691 000 801. The next program that we run is CanSarthi. It is a skill development and rehabilitation course, because a person diagnosed with cancer is always considered as unproductive to the society. Companies used to throw them out thinking they will no longer be useful to us, or maybe people think that their disease will spread to us. So they are asked to take sick leaves, or they are asked to stay at home. So as a result, they become jobless because they have a family to run, maybe they have medicines to buy, or they have their treatment to take. So what will a cancer patient do at that period of time? So for that, we used to provide them a course that is a 4-month course, comprises of practical and theory papers. And after doing that course, one can become a certified caregiver. And after that, they can work in hospital, NGOs, and home care agencies. So also, like, anyone can do this course, but the course is totally free for patient, their attendant, or anyone's family touched with cancer. If someone else wants to do it, the we used to charge, and we only used to charge because that helps us to cope up with the faculty that used to come for teaching. The last program that we run is Can Chetna. So Can Chetna is an awareness initiative where we provide awareness to different communities, groups like schools, colleges, universities, corporates, organizations. And we do it physically, but right now we are also doing it on an online platform. And for this program also, we have interns. And today's program was organized by Sayani. She's a program intern from St. Xavier's University, Kolkata. And if you want to know more about our organization, you can visit our official website page, that is www.sanjeevanilifebeyondcancer.com. And we have two YouTube channel, one in the name of Sanjeevani Life Beyond Cancer, and also other one in the name of Ruby Aluwalia, that is on the name of our founder. So moving forward to the presentation, we are going to discuss about cancer in a very simple terms today, because whenever we talk about cancer, it is always carcinoma or sarcoma, or maybe let's say metastasis. And as a result, we find it very difficult to understand, because when we talk about COVID, it is always like wear a mask, keep sanitizer. If your temperature rises, go and visit the hospital or the doctor. So we know that these are the things we have to take precautions for. But when we talk about cancer, nobody talks so like, in a simple terms. And as a result, it becomes very difficult for us to understand that how to prevent this disease, because COVID might be considered as pandemic, but cancer is the second leading cause of death globally. So we have to work on that. And how we will work on that, today we will discuss about that. So our organization is basically based in Mumbai, but apart from that, we are working in Wardha, Jaipur, Kolkata, Ahmedabad, Bangalore, Delhi, Surat, Guwahati, Goa, Pondicherry, Bikaner, Rishikesh, and Nagpur. So today we are going to discuss about three aspects of cancer awareness. First, how to reduce the probability of getting cancer. How can you protect yourself from being a victim of cancer? Secondly is early detection, how you will understand that your body is sending you some signals. Because always keep this in mind that cancer is not a disease that will happen to you in a day. It is a disease which grow over years in your body. Maybe now you're all okay, but maybe after 20 years you will be diagnosed with cancer. So maybe the reason will be very simple. Maybe you were smoking, you were following an unhealthy lifestyle. Maybe reason can be anything. Okay, so you have to understand, you have to communicate with your body. If something abnormal is going in your body and it is lasting, it is persistent, then immediately rush to doctor, because your body is sending you signal that something is not right. And the third is make a substantial difference in a person's life diagnosed with cancer. So basically, how to deal a cancer patient, how to interact with a cancer patient. Because in this aspect, most of us do lots of mistakes. We don't know how to talk, and as a result, we tell such statements that life become more harder for them. So we will also discuss about that. So now, moving forward, what is cancer? Cancer is the growth of irregular, uncontrolled growth of abnormal cells anywhere in our body. And we all know that our entire human body is made up of cell. And cancer is exactly a disease that happens in the DNA of our cell. But our cell used to renew mostly in 7 years. and the old cell used to die because they do not have anything productive to do in our body. But then the old cell might gets triggered, or they might grow in our body, causing negative impacts such as creating lumps or tumors in our body, or transforming all the good cells into cancer cells. But how it will happen? So there are three leading factors of cancer. First is increase of toxicity. So toxicity means when your body becomes too much of poisonous, too much of acidic. Like if you're sleeping, you're feeling heavy, you're waking up, you're feeling heavy, you need like cup of coffee to or tea to start your day, otherwise you don't feel fresh. Or maybe like you are having lots of acidity problem, gas problem. This might be result of increase of toxicity in your body. Next is low immune system. So this lockdown we have heard a lot about immunity. So it is a very fact that not only COVID or cancer, if your immune system is strong, it will help you to prevent all the diseases in your body, be it simple fever or be it any other big disease like cancer or cardiovascular disease. So it is very, very important to keep your immune system very strong. And the third is unhealthy lifestyle. If you're following any kind of unhealthy lifestyle, if you're not sleeping properly on time, if you're not eating properly on time, if you are following a very lifestyle with full of alcohol, tobacco, gutka, pan masala, like indulging yourself in such activities, then also you might lead an unhealthy lifestyle. So these are the three leading factors of cancer. So as there are three leading factors of cancer, there are also three contributing factors that boost your immune system. So when I talk about the contributing factors, so first come the thought process. So why it is important to boost your immune system? Because it act as a defense mechanism. There is no such injections or there is no such medicines that will prevent cancer, because it is a lifestyle disease. You become what you eat, you become what you think. Okay. So first is the thought process. Thought process is how positive or how negative we are about things in our life. So most of the time we are always negative, right? We used to complain so often. We are sad, we are depressed, we are never satisfied with whatever we have, or we get angry, frustrated, so jealous, hatred. So these kind of emotions are always negative, and this kind of emotion releases lots of negative hormones in your body that makes your that makes your body toxic, which is the first leading factor of cancer. Okay. And also, why do we have lots of negative thought process? Because we expect a lot. Our expectation is more always, and we always focus on taking rather than giving. So try to always expect less, try to always give more. When you give people more, or when you give something, then you are at the state of satisfaction. Do not stay in a mode that I will get something, I want something. So if you don't get it, you will get angry, you will get sad, you will get depressed, and this is the reason of negative emotions in your body. And also it is very, very important to try to find out positivity out of everything. For example, we can take the latest COVID example. So for many, it was it was a pandemic, it was worst, it is bad, it was negative. But for many it is also positive, because we are learning lots of things during pandemic. We are learning more about technology, we are learning more about how to deal our life with this digital India and all. So like we have to try to find out always the positivity. A situation, a best like your best situation also might have negative aspect, but if it is meeting your needs, that's why you feel that it is a positive situation. If it does not fulfill your need, you consider it is as negative. So try to always extract the positivity out of it. The second thing is nutrition. Nutrition is what are you eating, at what time are you eating, and with what intent are you eating. That is very, very important. So whenever you wake up in the morning, it is always suggested to start your day with 2 glasses of warm water. You can you can have warm water in any form you can, like you want, if you want to mix lemon or honey in it, or if you want to add tulsi juice, or maybe let's say black pepper juice, you can do that also. You can go for detox water also. Entire day you can be on detox water. So how to make detox water, that also I will tell you. And the first thing is like, try to start your day with warm glasses of water, and rest of the day try to drink lots of water till 4 o'clock in the evening. And after 4 o'clock, drink whenever you are thirsty. So how to make the detox water? You can take a glass jar, which is always suggested. You can take a glass jar and you can cut lemon, and you can add ginger, and you can put water in it, and in that jar only you can drink water for the entire day till night. Also you can make with cucumber and mint leaves detox water. You can also make with mangoes or ginger. You can go for tulsi. You can make detox water. There is YouTube channel, you can see how to make the detox water, and detox water is very helpful for your body. The next thing is, try to start your day with fruits, and have lots of vegetable in your meal, because 60% of your diet should always contain raw fruits and colorful vegetables. So it is very very essential that you include lots of fruits and vegetable in your meal, because fruits and vegetable helps in faster digestion. It helps in making your body alkaline, and also it boosts your immune system. And the third is, with what intent are you eating? So for our Indians, dining table is considered a kind of a discussion place, right? We used to indulge ourselves in lots of conversation. We used to indulge ourselves in lots of day-to-day activities. What happened in neighborhood? What happened with your friends? What happened in office, school, college? You will watch Netflix series while you're eating, or you will watch television. So whenever you are doing that, you are not respecting your food. And if you don't love your food, your food is not going to give you return whatever you need to get from the food, the essential nutrition. So do not divert your mind while you are eating, be it for 5 minutes, be it for 1 hour. Whenever you are eating, always focus on having the food and concentrating on it. And instead of having bigger meals like 1 plate of rice or 2 plate of rice, try to break your meals, like every 2 hours you can have something or the other. Maybe dry fruits, maybe nuts, maybe sprouts, maybe fruits, maybe salads. But try to break your meals. Do not let your stomach get hungry, but at the same time do not eat so much that it get that it the fats get stored. And if you are not having a cow or any kind of like milk from your own home, or if you're not looking the rearing of the cow and all, do not go and buy the dairy products. It is very harmful, because nowadays milk and all has lots of hormones. So try to avoid the dairy products. You can use it once in your meals and all, like cheese and butter, but always do not go for that. The last one is breathing. Breathing is a very very natural pattern. So we do not focus on our breathing, because we know that to survive we need to breathe, and it will happen naturally. And as a result, we only breathe till our chest, and then we exhale the air. We do not take proper oxygen. So why am I talking about oxygen, fruits and vegetables so much? Because these three things contain alkaline. As in a toxic body you might get cancer, in an alkaline body it will help you to prevent cancer. So it is very important to breathe properly, and while you're breathing in, always make sure that your stomach get outside, and whenever you're exhaling the air, your stomach should come in the normal position. That is the right pattern of breathing. And while you're breathing, try to dedicate 2 hours in a day, like maybe half an hour in the morning, afternoon, late afternoon, evening, night, and try to focus on deep breathing. And while you're breathing, taking deep breath, your backbone should be always straight. The next we are going to discuss about the second aspect, that is early detection, how we will understand that our body is sending you some signals. So here are some symptoms, but it does not mean that if you have the symptoms you will get cancer, but then if you ignore this in the later period it might form into cancer cells. So first, if you observe there is any kind of change in your bowel or bladder habit, such as bleeding, discharge, if your stool movement is becoming very thin, or there is a color change, if it is very painful, burning sensation, then you have to immediately rush to doctor, because somewhere this might be a symptom of uterus or colon cancer. The next is a sore that does not heal. A sore can be in and around our mouth. So it might be due to deficiency of vitamins, which will naturally gets healed by 2 to 3 days. But if you get a sore by consuming tobacco related substances such as pan masala, betel nut, gutka, tobacco itself, then also you might get a sore. And if you're getting a sore through that, immediately understand that your body is telling you to immediately quit it, because if you do not stop, your sore might increase day by day, and you might have color change, it might have lots of burning sensation, and as a result you might get hole on your face. And then what will happen when you get a hole on your face? Then you it might be a symptom of oral cancer, or also you might get a lump or tumors on your face. So it is very important that if you get a sore, immediately stop consuming any kind of tobacco related substances. The next is unusual bleeding or discharge. So whenever we talk about unusual bleeding, it can be from anywhere. It can be from your bowel or bladder habit. If you are not feeling well, you had vomiting, then also you might find blood, and this might be somewhere a symptom of oral or lung cancer. And also if there is any kind of bleeding or discharge from the nipple of your breast. So when I talk about bleeding or discharge from the nipple of the breast, it is a symptom of breast cancer, and breast cancer might happen to male and female both. It is not only associated to female. The next thing is thickening or lump in the breast or elsewhere. So whenever you take bath, use your three finger, try to observe in your body that is there any kind of lump or tumors on your breast or anywhere in your body. So if you observe that there is a hard mass and it's not moving and it is making you uncomfortable, so you have to immediately rush to doctor, because whenever we talk about tumor, there are two type of tumor. One is the malignant tumor and other one is the benign tumor. So malignant tumor are generally cancerous tumor which spreads rapidly in your body, and benign tumor are non-cancerous tumor, and 80% of the human body get benign tumor, not malignant tumor. So whenever you go for the checkup, it is very important, because otherwise you never know, if it is malignant it will spread to your entire body. So it is very important to go to doctor, and doctor might ask you to undergo a test that is called as biopsy. So biopsy help us to detect cancer cells in your body. And after that, if it is malignant, doctor might ask you to undergo 3 treatments of cancer, that is chemotherapy, surgery and radiotherapy. But if it is a benign, then you don't need to worry, because doctor might ask you to just undergo a simple surgery, or maybe take some medicines. So as soon as you find lump anywhere in your body, be it small or be it large, you have to immediately go and meet the doctor. The next is indigestion or difficulty in swallowing. So people who have indigestion problem very frequently, you need to change your eating habits, you need to change your pattern of lifestyle. Otherwise it might weaken your immune system, because you do not get energy from the quantity of food you are eating, but you will get energy from the quantity of food you are digesting. So it is very important to digest your food properly. If it is not getting digested, there is no meaning of eating the food. So always make sure that if you are having any indigestion problem, it is not frequent. If it is frequent, then immediately change your lifestyle. The next is obvious change in the wart or mole. So wart is very rare in human body. Due to HPV or due to any kind of virus attack, you might get warts, but then mole is present in every human body, that black dot or the red dot we have got. So if you have got any kind of mole in your body, and if you observe that the mole is increasing day by day, it is very painful, there is some kind of discharge, and your mole is spreading all over your body, then this might be a symptom of skin cancer. So it is very essential to rush to doctor immediately. And the last one is nagging cough or hoarseness. So whenever we talk about nagging cough or hoarseness, it is very common once in a 6 months. But if you observe that your cough is frequent and you're taking all sorts of medicine, you are not getting recovered, you are having cough, your voice is already broken, it's been 4 5 months, then you have to rush to a proper doctor, because somewhere this might be a symptom of oral or lung cancer. Now we will discuss about the risk factors of cancer. And whenever we talk about risk factor, then few things come in our mind, is like tobacco use, cigarette, marijuana, gutka, pan masala, tobacco itself, alcohol. So these things come in our mind, it is natural, because 22% of the Indian population is affected by cancer only due to consumption of these substances. There are so many other factors, but this only comprises of most of the things. So it is very important to understand that consumption of these things, is it essential for our body, and if it is essential, why it has become so essential that it can master over our mind. Secondly, you have to understand the later consequences of it, like what if I continue this, then what is going to happen, right? So YouTube is there, Google is there, search engines, lots of search engines are there, every day we use phone. So try to do some research on that, and that will help you to understand that are you taking the right thing for your body. Okay. And the next thing is, if you are an addict, for example, you need 5 packets gutka every day or 1 packet cigarette every day, and you are unable to leave it, like you think that you will leave, but immediately your mind used to tell no, go and have it. So then you have to understand that this is a small part of your craving. Our human mind used to think 60,000 thoughts in a day, and this is just a small thought in our mind. So you have to control your craving. And also you can do a simple experiment of cutting ginger into small pieces, mix it with black salt, place it under sunlight. You will observe that the ginger pieces are becoming very dry. So you can put it inside your mouth whenever you feel that you want to smoke or you want to drink, because that will help you to control your craving. Okay. And the next is stress. Whenever we go discuss about stress, stress can be from any emotions, be it from good emotions or bad emotions, it can be from anywhere. So the main point is you have to be away from stress. As soon as you get stressed, divert your mind. But then there are two type of stress, one is the eustress and other one is the distress. So eustress are generally good stress and distress are generally bad stress. So for example, like you want to get promotion in your office, or for example you want to top in your examinations, or you want to crack IS examinations, and you will continuously work hard for it, right? And you will always have a stress in your mind that what if I do not crack it, what if I have left it out behind. So you will again work hard. So as a result, what happened, it makes you a better person, it makes yourself a better version of yourself again. So basically this kind of stress are not at all bad stress. This keeps you motivated, encouraged to reach your goal. But then there are negative stress, that is anger, depression, anxiety, hatred, jealousy. So these kind of emotions are negative emotion that releases lots of negative hormones in your body. So whenever there is negative emotion, try to divert your mind, because this is your body. You will not allow your body to release negative hormones, because if you're jealous about someone or if you're angry on someone, the other person will not be harmed, it is you who will be harmed, right? So it is very important to understand these things and work on it. So if you get very angry, what you can do is you can do backward counting, that is from 100 to 1. You can also you can, whenever you get angry, you can also do backward alphabetically wise from Z to A, because till the time you reach A or till the time you reach 1, you will understand that your anger is gone and your mind is diverted, because backward counting needs lots of attention. The next is, if you are sad, if you're depressed, you can maintain a diary or a journal to write, because when you're in a negative stress, it is always suggested to throw the negative stress out. So write it down, everything in your paper or diary or whatever you want, and after everything is sorted, you can tear the paper, you can throw it anywhere. That is totally up to you. The next exercise about anger is, you can always take deep breathing and then release it from your mouth. So take a slow deep breathing and release it from your mouth. So this is a simple exercise that you can do, because whenever we get angry, there are two parts of our nervous system. First is the sympathetic system and other one is the parasympathetic system. So whenever you get angry, your sympathetic system gets activated, and as a result, what happens, like you get angry, you get when you get angry, your blood pressure gets high, your breathing pattern in like immediately starts going higher, because you feel that you're not getting oxygen properly, then your blood circulation is constricted. But when you do this simple exercise, when you are angry, very angry, when you do this simple exercise of breathing in and slowly releasing from your mouth, then in that exercise what will happen, your parasympathetic system will be getting activated, which will bring your blood pressure in normal position, smooth circulation of blood, and smooth flow of oxygen in your body will be happening. The next thing is obesity and being overweight. So we all know that fats in our body means inviting lots of diseases in our body. But there is a misconception that thin people will not have any disease, or they don't have any disease because they don't have fats. So you have to understand that anyone who follow a unhealthy lifestyle is prone to get diseases. Okay, so it is always suggested that you should always maintain a healthy weight. You don't need to be a slim figure of 40-45 kg. You don't need to be obese of 80-90-100 kg. What you can do is maintain a healthy weight according to your BMI. So now, what is BMI? BMI is the body mass index. You can check it in your nearest medical store. So BMI says that according to your height and according to your age, you have to maintain a healthy weight. For example, if I'm 25 years of age and my height is 5 feet, then I have to weigh minimum 50 to 55 to 60 kg. If I'm more than that, if I'm 70, 80, 100 kg, then I am an obese. So it is not at all impossible to maintain a healthy weight. So it is always suggested that everyone should maintain a healthy weight. The next is unhealthy diet with low fruits and vegetable. I have already mentioned that it is very, very important to eat lots of fruits and vegetable in your meal. But we are in young generation, lots of development, lots of we have outlets, we have pizzas, we have chicken, fried chicken, processed chicken, we have chow means, we have egg roll, we have veg roll. We love eating junk food, right? But like I would personally suggest that you can always go for junk food once in a month, but rest of the month, days of the month, you have to detoxify your body with lots of fruits, vegetable, and water. Okay. The next is inadequate physical activity. So we all know that cardiovascular disease is the first leading cause of death and cancer is the second leading. So to prevent these two diseases, physical activity does magic. How? Because when you do exercise, there is smooth functioning of your heart, smooth flow of oxygen in your body, smooth circulation of blood in your body. These three factors are very essential. The next is lack of sleep. If you do not sleep properly on time, then also you might be at a high risk factor. So sleeping 8 hours is important, but it does not mean that you will sleep at 4 a.m. in the morning and you will wake up at 2 3 like p.m. in the afternoon. So that is a wrong pattern. You have to always finish your dinner latest by 8 to 8:30. You have to sleep 3 hours after your dinner or 2.5 hours after your dinner. Do not immediately jump to bed after having your dinner or meals. Try to have a light walk, or maybe after half an hour you can go for a simple dance movement also if you want. So that will help. So it is very essential to sleep properly latest by 10 to 10:30 and wake up early in the morning by completing 8 hours. That will help you to follow a healthy lifestyle. Then the next is, if you have any kind of sexually transmitted diseases, your immune system is already fighting with that virus, so you have to take special care of yourself. And while sleeping, do not keep your phone under your pillow or near your bed or under your blanket or near your body. So because phone emits lots of radiation which have higher chances of brain tumors or brain cancers, so always keep your phone while sleeping on a table or in the next room. That will help. So now we are going to discuss about the most common forms of cancer. So there are various forms of cancer because cancer is a disease that happen in our cells. But then there are top 5 cancers that affect the Indian population most. And the first one is the breast cancer. So breast cancer, as I have said, that it can be in male and female both. And if you observe there is any kind of bleeding, any kind of tumor in your breast, then, or if you see that your nipple is being pulled inside, because our nipple is always facing outward direction, if it is pulled inside, or there is a persistent pain near your breast, then you have to immediately rush to doctor because this might be symptom of breast cancer. The next is oral cancer. For oral cancer, it is highly recommended you should avoid any kind of tobacco related substances or alcohol. But then also you have to keep this in mind that do not take too much of hot liquids or do not take too much of chilled liquids, because there should not you should not get any kind of scratches in your esophagus. So it is very very important to bring your food in a warm temperature and eat, and bring the chilled water in a normal temperature and try to have it. Do not take immediately ice water, or as soon as you take out food from the fridge, do not start eating it. That will be very harmful. And secondly, do not eat food that is being kept in fridge for 3 to 4 days. Fruits and vegetables you can use, but cooked food, try to always eat fresh. The next is cervical cancer. Cervical cancer is a totally women centric cancer. So if you have women's or girls who have a white discharge which is very frequent, or if you see that there is some kind of pelvic pain, or if you have indulged yourself in a sexual activity before the age of 18, and you have married someone and before the age of 20 you gave birth to child, or if there is pain during sexual intercourse or painless blood during sexual intercourse, might be a symptom of cervical cancer. The next is gas. So gastric is something all of us used to avoid. Most of the people have the habit that they will take medicines in the morning. Every day they will start taking one medicines. So why take medicines when you can cure it yourself, like drinking lots of water, eating the right food on the right time. If you eat pumpkin vegetable in the night, or if you eat leafy vegetables in the night, it is so obvious that you are going to have gas. If you eat fruits in the night, so basically we have to understand what is the right time to eat the food. The and if you ignore gas, like you will drink water and then you will take medicine and you forget about it, and you follow the same lifestyle, eating too much of non-veg all the time. So try to understand that if you do not care about gas might turn into gastric ulcer, and as a result you might get gastric cancer. And the last form of cancer is the lung cancer. Lung cancer is mostly seen in the like smokers. So when I talk about smokers, there are two type of smoker. One is the active smoker and other one is the passive smoker. So active smoker is the one who will light the cigarette themselves and they will smoke. But the passive smokers are the one who do not smoke, but then they stand in front of the person who is smoking always. And as a result, what happened? The air that is released from the mouth of the active smoker is immediately going inside the body of the passive smoker. And then that passive smoker can be anyone, your best friend, your partner, your maybe sibling or your parents. So whenever someone is smoking in front of you, try to tell them that please go outside and smoke. If you feel this is rude, then you can get up and go to other side, because it is very important to keep yourself safe. And also everyone have family planning, that they will do a job, they will grow up, they will then work, and then they will get married, they will have child. So if you are a smoker or if you're a passive smoker, then your blood might become toxic, and that toxic blood might pass to your child. So as a result, your child might get leukemia, which is the blood cancer. Okay. So now moving to the third aspects, we are going to discuss about the basic do's and don'ts when someone you know has cancer. So there are particular do's and don'ts which we have to really follow when we deal with a cancer patient. First, you have to let them know that you care for them. And secondly, do not sympathize with them, like, oh, what will happen, I feel so sad for that person. You don't need to feel sad, because cancer is as normal as any major disease. So do not sympathize. You can empathize, but do not sympathize. Second thing is, respect their decision about how their cancer will be treated, even if you disagree. So being an educated person, we know which hospitals are best for what. But then the person who is diagnosed with the disease might not know that, or even if they know, they might not want to go there. If they ask for an advice, you can obviously give advice. But then, for example, if someone is from let's say Karnataka, and they want to do their treatment there only, they don't want to go to Maharashtra to do their treatment, that is in Tata. So do not force them, like, why are you doing your treatment here, doctors are not good, you will not be recovered. So every hospital has good doctors, but the thinking, our thinking process is very important. So do not try to put these statements, because that will release lots of negative hormones in their body. The third is, include the person in usual work projects, plans and social events. So you should always include a person whenever there is something like this. Then you should always be a good listener. You can include them in everything and try to understand or listen to them what they want. Okay. The next one is, offer to help in a concrete or specific way. So if you're a student, you cannot donate money. You can do fundraising, you can give toys, you can give little things, but then you cannot do like give so much money for the treatment. So the first little help that you can do is, you can do fundraising for a patient or maybe patients. Or also what you can do, you can become an active blood donor for the cancer patient, because whenever you donate blood, a cancer patient needs lots of blood. So when you donate blood, you also stay healthy, and the and you are also saving the other person. So if you want, you can donate blood to any cancer patients you want. You can go to hospital, you can voluntarily, you can donate blood once in a 3 months. The next are some basic don'ts that you should always follow. First, don't offer advice they don't ask for, or be judgmental. So first thing, do not go for giving free advice, because until and unless no one needs your advice, don't give it, because it do not have any value. Because you will talk about hospital, maybe they are thinking about finances, you never know what is going inside their mind. So do not give advice. Do not be judgmental, like, I told you not to smoke, I told you not to drink, but you did, now see what happened to you. So don't give this kind of statement. You should never be judgmental towards anyone. Okay. Then the next is, don't assume they can no longer do the job. Do not think a cancer patient is unproductive to the society. If they want, they can continue doing their treatment and doing their work. It depends on how they are taking the disease. The third is, don't be afraid to talk about the illness. So being an aware individual, we should never be afraid. If someone is diagnosed with cancer, we have to explain them. You have to work on three things: your thought process, your nutrition, and your breathing. And even if you get cancer, you have the treatment, you have to do the treatment. Then you can get recovered. Treatment is there, few medicines are there, and then you can be all okay. And the next one is, don't tell a person, I can imagine how you must feel, because you really can't. So we genuinely cannot imagine how the journey of a cancer patient is, because the journey is totally very different. We don't understand it until and unless we don't get it. So do not tell this. You can tell that I will help you to get out of this situation. I will be there with you. You can say statements like that, but do not say I can feel you, because that is a fake statement. The last one is, don't go around someone with cancer if you're sick or have a fever or any other sign of infection. So, which means if you have any kind of communicable diseases, do not go in front of a cancer patient, no matter he is your father, mother, brother, sister, whoever, or your best friend. Do not go, because you will go with a very good intention, but while coming back, as it is a communicable disease, you are gifting that virus to the patient. And like already there, the patient's immune system is already fighting with cancer, and then if you give another virus, their immune system will be divided, and their survival chances will decrease. So it is very important, stay at home if you have any kind of communicable disease. Then now here is an important slide which shows that 32.6 million 5 years cancer survivor worldwide, which means cancer is not at all fatal if you work towards early diagnosis and its treatment. Only if you work on your symptoms given by your body, that is when you can prevent cancer. And there are so many survivors, and since an organization, we are working with cancer patients since last 8 years, and we understand that cancer does not mean death. So the last slide here says, is a very important quote by a cancer survivor himself. He has written that you beat cancer by how you live, why you live, and in which manner you live. So basically, you can beat cancer only if you understand how are you leading your lifestyle. If you put an emphasis on your lifestyle, you will understand how healthy or how unhealthy lifestyle you're leading, and you can become a change maker in this field. So it is very, very important. We need lots of young change makers, because like when you become a change maker, you take care of yourself, you inspire others, you take care of your family, your society, your community, right? And WHO tells that in the upcoming years, one out of every 10 individual will get cancer. One out of every 15 individual will die out of cancer. So that one person can be me, that one person can be you, that one person can be anyone. So it is always suggested that as much as you can, start working on your body and start awareing people. So thank you so much, everyone. I hope the session was useful for all of you. So this was all about cancer prevention and healthy lifestyle.
Now, as we
Students, madam, the seminar is Indian. Hello? Hello?
Yes, ma'am.
Seminar is over?
Yes, ma'am. Yes, ma'am.
Okay. Students, have you any questions? If you have a question, you can make it on chat box. Any questions, students, from student side or from the participant side? Okay, I hope that there is no question. Thanks, Mr. Sumki Begum, for a nice presentation. We get a lot information about the deadly disease cancer. During the span of COVID-19, we almost forget about this deadly disease. So her presentation warns us a lot. Thanks to our principal who helps a lot to organize the seminar, and special thanks for providing the technical support Mr. Shatanu Das, Professor Shatanu Das, and Professor Priyanka Dev. I hope the students get information about the cancer from this seminar. Now the webinar is over.
Thank you so much, everyone. Stay healthy, stay positive, and please take care of yourself. Thank you so much, everyone. Bye bye.